Hi everyone, this is Sharina Ankhi-Krol coming to you from Ankhi-Krol Law. As you know, I've started this episode, this series of episodes to talk to you about the impact of COVID-19 and how people's lives have been changed. So today we have with us a friend and a client of mine, Wing, and also Nicholas Rosado, and we are going to be hearing from them about their careers as flight attendants. They're both flight attendants and they actually met while working, so we're going to get into that as well, just so we can keep this a little bit interesting. Hi, Wing. Hi, Nicholas.
Hi,
Hello.
Trina.
And they're joining us from Washington State, so it's all the way across the country. So tell us about how your lives have been impacted by COVID-19.
Go ahead.
Well, we we are officially on unemployment May 2nd. So uh, where we work, a lot of people had to take a leave or face losing your job.
So when do you think this is going to end for you guys? Like when do you think you can go back to work?
It just really depends. There's a cure, I believe, or get this under control, because the things I have problem with, you may not have the virus or you may have the virus and you don't know it. So like a passenger on a plane, or it could be your coworker have it, but they don't show symptoms, so you may still get sick. And there's no requirement everybody have wear mask. It's still spreading, so it's still continuous spreading around the world. So that's why we decided, because with 3 kids together, so we decided to take the leave is for sake of our health and our kids. We can't keep going to work. We usually work opposite schedule as a flight attendant, so either one of us will be home with our kids. So now there's like either one of us has to be home, and then we're flying and we'll bring germs, or you don't know what you get into the house affect our kids and our health. So we decided to take the leave, but also, helping the airline industry try to save up some money, because like 95% of our flight being canceled, or the passengers are like only less than 10 people on the flight, sometimes even less, so people demanding of traveling is less compared to before, definitely.
Yeah,
So go ahead.
no, and I was going to say, and when we go to work, we wear masks, and to help minimize spreading the disease. Other people should wear masks, but a lot of people don't wear masks when they travel, and when they do, they do so many things wrong. Like they take it off, and then they touch their face, then they touch something else, and then they
And
put
they
their
roll
mask.
up in there.
Then they put their masks back on. It's people need to be educated on how to
Correctly.
how to correctly wear a mask. And it's ridiculous to see people. They put on a mask, but they take it off 20 times. Let's say in an hour, and it's like, congratulations, your mask is useless.
Yes, and also I've been seeing people in supermarkets with their nose out, but they have the masks from here down. And I wonder to myself, like, what is that going to do? You're breathing it in, and you're also letting your own breath out. So it's strange that it's happening even on flights. So my question to you is, when did you really start seeing a difference in like travelers' behavior? Like, when was it slowing down for you guys? Was it mid-March when everybody else was being, quarantined? That was like the very beginning of the quarantine stage.
I would say about April, the first week of April, because there's when our spring break started, April 5th, that week, I believe. And then everybody start canceling their flights, cancel their plans for spring break, and all the flight. We were still working on April. Today's the last day of April, but our leave start on May, but people's been not traveling since April. But on March, because they say, oh, it's nothing, it's just like a flu killed so many people. That's why I kind of understand how people say, oh, this is just a flu. But to me, yes, it's a flu, it's a virus, but this is stronger than before. I'm not a doctor, I can't speak from a doctor point of view, but people should take this seriously, because look at Italy, look at Asia, like everywhere it's spreading. It's not only United States. like people now protesting, opening up. I'm like, so how many people needs to be died in order to get this over with? What if there's no cure, doesn't get over with, you know?
Yeah,
Right.
it's like there was, I was seeing yesterday, we're at a curve now. We're at like
Flattened with
the curve has flattened, which is a good thing. But
in Washington.
So now everybody's like open everything up, open everything up because it's normal now. But no, it has to go back down again before things should get opened up again, because now we're at this point. It's the virus with social distancing. We've been able to people have been able to stop the rise of people
Mhm.
getting it and dying. But if the government opens everything up again, it's going to go back up again. It's like she said, people need to take it serious.
Unfortunately, yes, across the country now, even in New Jersey and New York, people are thinking about going back to the parks. I know in New Jersey, the parks are opening up this weekend. Today is Thursday, so we have, Friday in between, and then the parks are being opened. And just because they're opening the parks, there's this, I think, feeling in the air like everything is okay now, but it's not. Just because things are opening doesn't mean that the virus has also disappeared. And I don't think people really understand that. So, you guys are actually frontline workers because you were basically transporting sick people, even those who
Yeah.
either knew or didn't know. And oftentimes we don't really think of flight attendants as being, the frontline workers, right? So can you talk to us about a little bit of, like the dangers that flight attendants face as far as their own health, other than the obvious, maybe not just for the pandemic, but in general, like what sorts of dangers do flight attendants face?
As I work, you always have hundreds of people on the plane. Sometimes we do long routes, like minimum 9 to 12-hour flight. You circulate all the airs in the airplane for 10 hours. So with this virus, like I said, can survive airborne in the air for hours. So, and then you just circulate. And like, that's why I think it spread so fast and come to United States, because the first case was found in Washington State, but good thing that our governor, put a shelter in place, order. So that's why nobody going out and nobody spreading anymore. So that's why we've been flattening the curve. But as our work, we always touch a lot of germs, I would say, people on the airplane been flying on and off. It happened on the previous flight, it will, they try to clean it, then for the next flight, but I will never say.
I can tell you horror stories.
But let's not go there.
You'd never want to be on an airplane again.
But now, and I see,
Don't say it.
and now I see a lot of airlines take it seriously. They wipe it every chairs. They will spray some chemical. I don't know if it's healthy or not, like I say, but at least kill this virus or most of the germs. I have not seen, I have to say, I've been in this industry for 12 years. It's the cleanest airplane I ever seen. And we'll hand out the wipes, alcohol wipes to each passenger so they can wipe.
They should do that on a normal basis. You know what I mean?
I agree, but maybe because of this pandemic, it changed the world, how they handshake, they take things seriously.
Yeah. I remember when I went for my baby moon to Italy. I mean, I normally do this anyway because I'm a germaphobe, but I had a whole big container of Clorox wipes. I just pulled it out and I was just trying to wipe everything down, the seat next to me, the tray table, and the people around me were just like, what is her deal? And now, everyone is going after these wipes like it's a brand new invention, but you know what? You should always be using that. You just never know what is going to be there, even if it's not a pandemic level virus. There could be other things that are there. So I'm glad you brought that up. That may be something good that comes out of this, is that transportation hubs, transportation vehicles may become a lot cleaner as a result, because we want to prevent future breakouts, right?
Yeah, I think this pandemic we learn how to, like I've been teaching my kids on how to wash the hand correctly, and teach him how to put a mask on correctly. In Asian culture, if you're sick, you may not be sick or you don't feel good. You don't want to spread germs. So especially in Taiwan culture, I'm from Hong Kong, but Taiwan culture that I have a lot of friends, they always have masks at home. And because Hong Kong, since SARS, like my grandparents always keep masks at home too. If I'm sick, I'm sneeze, they give me a mask, just for the public health. Not only because in American culture, they tell us to put on mask if you're taking care of a sick person. But that's why I said this pandemic is different, because on the airplane, on the beginning, on March, we're not allowed to wear any mask. It's prohibited.
They weren't allowed, wow.
Yes, they were not allowed because they say
okay.
they're not uniform pieces. So they would not let us wear a mask. But because the CDC guideline was saying that you only wear a mask if you're taking care of sick people. But there's 200 passenger. Who do you know who's sick or not sick?
And they may not even know that they're sick, which makes it even worse.
Yeah. But
I mean, nobody really took it serious until, April, starting April. But, I mean, even our government didn't really, you look at the news conferences, everything's fine, everything's good, don't worry about it,
Everything under control,
and then, one day on the news, they say, it's like, okay, everybody needs to start wearing masks. It's a little late now.
Right.
This virus has been going for months and months.
Right. And what's been confusing to me personally, one day it's okay to not wear a mask, and then the next day, if you are sick, you wear a mask, and then the next day, everyone should be wearing masks. And then now they're onto spreading information that this virus can survive on surfaces for X amount of hours. Then they're saying it doesn't survive on surfaces. So there's a lot of conflicting information that's out there, whether it be from government entities or just, media or people in general, but it's not helping the situation.
I think I have different resources. Like I've been watching the Hong Kong news, the Taiwan news. I have a lot of resources instead of, I don't know, you watch German. He's German. I don't know, he watched German.
Okay.
But in English, in America, you only have one type of resource. You believe in the government. But I hate to say that government let you down. They didn't never teach you how to put a mask correctly. They didn't tell you how to wash your hands, because they keep telling you just do whatever they say. So that's why people is really confusing.
What I don't like is that we are one America, but we have 50 states, and right now it seems there's no leadership, and there's 50 governors doing 50 different things.
Right. No, I agree with that. Even
I'm not going to say who, but one person should step in and kind of take control and say, this is how it's going to be, instead of letting 50 governors doing 50 different things. It's if one state is on shutdown and the other state next door is open, it just doesn't make any sense.
I was just talking to our neighbor yesterday. So I came to the United States. I thought this is a United States, but I think it's a scattered state right now.
I think, with what you're saying, where I am, at least, I don't know, too much about Washington State, just because I've been bombarded with what's going on around me, being in New York, New Jersey area. If one state opens, it's not going to stop the residents from that state to go to the next state, right? So that is opening up the floodgates. I completely agree with that logic that, if one is doing one thing, the other one is doing another thing, it's going to cross-contaminate. And I feel like, if we're not all on the same page, it is going to spike at some point soon. But with that said, I just wanted to see what your opinion was on how travel will be changing in the future. I definitely think it will change, but how much of it do you think will change, and what do you hope to see?
I believe, my point of view, especially in Washington State, we've been in house order for a long time, and people are getting so crazy in the house, so they ready to go to the park, go out to like New Jersey or New York people. I think if the government or it's safe to go out, I think a lot of people, family is ready to take a vacation or go other places. But will that be international? I'm not sure, but I think it will back up. But would it back to normal? And I doubt it. If we can climb back up to 50%, I think we're in a good.
By when though? What do you think? When do you think we may reach the 50%? Would it be this fall,
No,
this
I think
winter?
I don't think falls.
I think next year, because right now it's starting the busiest time for all the airlines, but
Mhm.
nobody can fly. And then come when winter, the airlines scale back their operations anyway, because winter, less people are flying. So I don't think we're not really gonna see a real pickup on people of
Traveling.
lots of people traveling again until I think next year.
Yeah, and the thing is,
You
think
know,
about a lot of people have no job, unemployment at this moment.
yeah,
They have to
Mhm.
catch up with their bills, and a lot of people already struggle right now. So that's why I say, and then Christmas is coming, Thanksgiving is
and
coming.
I just
So
saw that we're up to
not this year, I
we're
don't
up to
think.
almost 30 million people that have lost their jobs. And like
Right.
she's lots of people on unemployment. I know the government said that you can defer your mortgage for up to a year, but
You
the
still
more
have to catch
yeah
up and pay
at
off.
the end of the year you still have to pay back the mortgage
Is
company.
it up to a year now? I only knew about up to 3 months. I'm not really sure.
Washington State
I know
is
Washington
different.
State is up to a
It's every
year,
Okay.
state is different. You have to.
but
Yeah.
but then you have to pay it back.
Right.
So it's like you're not really yeah, you're getting your mortgage deferred, but you still have to pay it back. So there's going to be people are not really going to have a lot of money to travel per
Right.
You
se.
hope you have a job to pay after that,
Yeah,
right?
and like you hope you have a job when this is all over, because
Right.
there's so many small businesses that are closing. So it's
Small businesses
I don't.
especially are taking such a hit right now. That's, I only work with small businesses and I am seeing a complete devastation. There is absolute despair right now, but I feel like maybe by next year there's going to be, a rise in the number of small businesses who start up, maybe trying to make their own luck and not depend on employers because of so much unemployment that has happened. And what I wanted to get from you guys too is, do you think travel behavior will be changing as a result of this, from like college students or people who regularly travel? Do you think their behavior pattern will be changed by the pandemic?
I don't think so,
Okay.
because people forget so easily. Because I lived and flew when 9/11 happened, and after 9/11, it took about 3 or 4 months, and it was like people already forgot what happened. They come on the airplane and they still act crazy, and like people will forget, and I don't think people are gonna, for the majority of people, I don't think people are going to
It
change their
takes
habits.
time. Kind of like you get burned, you get hurt, and
Mhm.
it take a while. After it heals, you still want to go to Hawaii, hang on the beach with your family. It will come back.
No,
And then people still do business and business trip. But like I
Right.
said, I think the hygiene, the public health says how to protect if you're having cough or just a normal cough or sneeze, maybe wear a mask to protect other 200 people on board. I think that will be a good hygiene practice, and clean the seat, all that thing. I think it should be do regularly.
Mhm.
yeah.
Okay. Yeah,
When
go
it comes
ahead.
to
Please.
when it comes but like I said, when it comes to people changing their behavior, I they might do it for a little bit, but like I said, people forget. People forget.
Yeah. I agree. I agree. They probably will forget, but maybe, for another year, this sort of pandemic mentality will stay in place and maybe they will be better with hygiene. So now let's move on to the fun part of our little interview today. Tell us how you met.
We met on a flight.
Yeah, we
We're
met on.
both flight attendants. Like work, basically.
I like to say I'm from Germany. She's from Hong Kong, and we met on a flight to Pittsburgh.
Okay. So then you decided to just move to the US?
No, I was living I since 1997. So he
Okay.
lived.
We immigrated back in '85.
Okay.
Yeah.
Okay. So, I mean, how did you pick Washington State?
Well, it was through my dad's job. He used to be an independent contractor in the military.
Okay.
And there's lots of military bases here in Washington State, and it was a good jump off for him to go to Asia, because back when he used to do that, now he's retired. There used to be military bases all over the place in the Philippines. A lot of them are obviously closed now, but back then, that's what he was doing. And so that's how we ended up in Washington State.
And we date for a while. Back to your questions. We met, and then we were dating for a couple years, and then he wanted to settle down. And then we picked Washington is because his dad retired in Washington. So we want to live close by them, and also as a good babysitter if we need it.
That's always helpful.
Yeah.
So I want to ask you, do you think it's a good idea for people to buy cheap tickets right now for fall or winter? That's a question that's been floating around the internet for a while, since the lockdown officially happened in most states. So is that a smart thing to do because tickets are cheap now, or would you recommend that they just hold off until people can figure out what is really going on?
To me, you just like going to Vegas and gambling, buying red or black. You may get the best out of it, or you may forfeit your ticket, cannot go anywhere. It's a gamble to me at this point. I mean, good for you if you have a plan, got a cheap ticket and able to use it.
Right.
Or you buy the cheap ticket, and if you get the virus, you get sick of them or anything happen, does that cheap ticket help you get you anywhere?
Right.
That's why, I mean, our government's, the healthcare system is really expensive. That's why we decided to believe. I'm like, yes, we don't make much money right now. All the flights got canceled. We can't work, basically. There's no hour for you to work anyway. But collect unemployment, yes, some money, but the risk getting sick is high. Getting the virus is high on the plane. And then you come home, how much, I would actually want to know how much those patients who got COVID and have to pay.
Mm-hmm.
I would say 30,000 minimum.
Yeah, I have no idea, but I would imagine it's pretty high. Yeah, so just to answer the question, if anyone has it, I'm not booking anything right now until I figure out what is going on. It's probably not going to be until next year that I book any sort of flight, like you said.
No, I mean, I would buy tickets, but only if if airlines allow you to extend, the like up to a year, for you to fly.
Or refund.
Right.
Then it's a good idea if the airlines are willing to extend the ticket that you have,
I would tell you to buy it, so that's why you can pay me back to work, right? But that's not really the case. I'm being, honest in the middle.
Basically, you want to be safe or sorry.
Sounds good to me.
People buy the ticket. Sorry, I think people buy the ticket is because they're young. They think they can fight for it. It's not nothing that's not curable,
Mm-hmm.
But they don't want to crash the healthcare system, flush all the hospital bed and ventilator, right? So that's why I say to them, they have more encouragement or brave. When we're old, we get sick, we have kids with responsibility. It's a different point of view in our life stage.
Right. So before I let you guys go, I just want to get some word of advice from you to travelers, and then, maybe even just people in general who are sort of, unsure of what's going on and are starting to lose hope, because we're at that stage of having been scared, having been confused, and now I think people are just getting upset and depressed of staying home. And as you said earlier, people are just losing their minds, in the four walls of their home, whether it's with kids, spouse, or alone, or with a pet. Everyone is feeling some sort of anxiety or pressure after being in lockdown for so many days. So what would your advice be?
You want to go ahead?
You go first.
So I would say, our life is pretty busy, and a lot of parents in America work full-time job. Most of the time, we work opposite schedule. So we only have like few days a month that we both off and spend time with the kids. So we always complain, we need to do more things with our kids. I think this is a good time because we'll be here with our kids, and a couple of our kids are teenagers, they usually don't want to do anything with us, but now they're stuck with us in the house.
They have to.
So you have to. So we've been doing a lot of games, or actually more talk. They don't want to hear us most of the time or listen to us, but I think this is a good bonding time. Look at it this way. And then I love cooking, and I've been cooking crazy.
I have
And,
seen the pictures on Instagram, so yes, I know.
and then my two good things are my two teenagers are able to eat it all. You know,
I
they
wish I was closer to you. I would come by for food, just, curbside pickup.
yeah. So that's why I'm saying there's a lot of things we can focus on instead of the negativity. I understand how people getting crazy. Sometimes our job would keep our marriage longer. but now, like with him all day long, like it's a little bit much, but like I said, we'll have our corner. I go upstairs in my rooms, have my quiet moment, and he will watch his TV, or sometimes we just take a walk, just chill. Doesn't need to say anything, but I think that's a good time to bonding with your family. And you getting, I mean, we are getting paid unemployment to spend time with our family. Why are you depressed?
Right.
I don't know. But I think a lot of the hardest part for me is I have homeschooling my kids. My white hair is coming out.
Yeah.
It's tough to teach your own kids. And then my little one is 6 years old, and I don't have a degree. I'm not good at with patience. So it's training me. I'm learning too as along the way, and I have to learn how to teach my kids. And different age, different kids is different. So I'm like, this is a learning part. You're getting paid to spend time with your family and learn something new skill in your life, or you can just learn how to build a shed or something.
That would be nice.
Fine. That's my
shed.
yeah. Yeah.
I don't know. I've been trying to work out a lot more. It just because working out is good for you. It's healthy for your mind. So, and I've been going on a lot of bike rides too. Just if it's better to get out and do something. Even if I mean, I'm not saying going to the gym because nobody can anyway. But find an exercise routine. Keep yourself busy. It's healthy body, healthy mind.
Sounds good. Well, thank you guys so much for giving us this rare view into the insights of flight attendants. And I'm so glad you guys are able to join from the other side of the country. Now it feels like in another world. So I know I haven't seen you in a while, so it's good seeing you. Thank you so much, and I hope you guys enjoyed talking with Wing and Nicholas. And I hope you have a chance to look at the other videos I've done on the impacts of COVID-19 and how it has impacted everyone from different walks of life. Thank you. Have a good one.
Thank you.
Thank you. Bye-bye.